This content is for educational purposes only and is not medical advice. The content is provided for reference only and does not claim to be exhaustive or complete. Users should always consult with a qualified and licensed healthcare provider. Reliance on the content is solely at the user's risk. Emergency needle decompression. Needle decompression of the chest is a life-saving emergency procedure for suspected tension pneumothorax. Tension pneumothorax is the presence of air or gas in the cavity between the lungs and the chest wall, causing excessive pressure on the opposite lung, the great vessels, and the heart. Patients can die very quickly from a tension pneumothorax. Emergency needle decompression will relieve the immediate pressure and allow time for placement or transfer for a chest tube. A tension pneumothorax is suspected if shock and the following are present: difficulty in breathing, absence of lung sounds on one side, hypotension, distended neck veins, hyperresonance with percussion on the affected side, and tracheal shift away from the affected side. Gather supplies: 14-gauge IV cannula, gauze, and tape or plaster. Ask for help. Use personal protective equipment. Wear gloves and eye protection, and if needed, a gown and mask. Expose the chest. Identify the midpoint of the clavicle on the affected side. Palpate the ribs, counting down to the second intercostal space between the second and third ribs. Just above the third rib, insert a large bore 14-gauge IV cannula at a 90-degree angle to the chest. Listen for a gush of expelled air. Remove the needle. Cover and secure the IV cannula. Start large bore IV lines and give IV fluids. Give oxygen at a high concentration, such as with a non-rebreather mask. Prepare to hand over or transfer the patient for a chest tube.